again, thank you everybody for joining us. I think we're just going to wait a couple more minutes to see people trickle in. I know with technology, sometimes it takes a hot minute. So hopefully we'll be able to get started soon. Thank you.
So I think I'll go ahead and get started. Some people I'm sure will continue to trickle in, but they can, I'll just go ahead and get started. So first of all, thank you all for joining us. My name is Leah Nichols, and I'm the Executive Director of Mason's Institute for Sustainable Earth. I'm delighted to welcome you today to the first of our 4 webinars focused on the intersections of sustainability science and the current health and economic crises. In today's webinar, our distinguished panel will discuss the relationships between preparedness and resilience in the context of this pandemic. However, before we begin, just a little housekeeping. First, we will keep everyone in listen-only mode throughout the webinar. Please do not turn on your video. If you already have done so, please turn it off to preserve bandwidth. If you have any questions throughout the webinar, please enter them into the chat box. We will pose some of the submitted questions to the panel during the Q&A session at the end of the webinar. Please also note that we are recording this session. Now, in the interest of time, I'm only going to give a brief introduction to our speakers and our moderator, and then turn it over to them so we can get started. Our first panelist is John Balbus. He is the Senior Advisor on Public Health at the U.S. National Institute of Environmental Health Sciences, NIEHS. He advises the director and serves as NIEHS's liaison to its external constituencies. He also directs the NIEHS and World Health Organization's Collaborating Center for Environmental Health Sciences, and he serves as the U.S. Department of Health and Human Services Principal to the U.S. Global Change Research Program. Our second panelist is Greg Koblenz. He is an Associate Professor of Government and Politics and the Director of the Biodefense Graduate Program in the Schar School of Public Policy and Government here at George Mason University. He's also a member of the Scientist Working Group on Chemical and Biological Weapons at the Center for Arms Control and Nonproliferation in Washington, D.C. Our third panelist is Andrew Light. He is a University Professor of Philosophy, Public Policy, and Atmospheric Science at Mason, and a Distinguished Senior Fellow in the Climate Program at the World Resources Institute. He's also worked as a staff climate advisor in the U.S. Department of State's Office of Policy and Planning, where he served on the senior strategy team for UN climate negotiations. And our moderator, Ellen Leitspin, is a professor in Mason's Schar School of Policy and Government, where she directs the International Security Program and the Center of Security Policy Studies. Prior to joining Mason, she was the vice chair of the National Intelligence Council. She's also served on the State Department's policy planning staff. Now I'm going to turn it over to Ellen, and she'll take it away. So thank you very much for joining us.
Well, thank you, Leah, and thanks so much to everyone. Good afternoon. I think we should have a very productive and interesting conversation for the next hour. As our 3 wonderful speakers each have distinct areas of expertise, but they really do kind of complement and a little bit even overlap as we think about the very interconnectedness of our society and our states and the international community's requirements for thinking about sustainability in the face of the pandemic and, preparedness in general. Are we getting better at it, or are there some important gaps that need to be filled? So what we've decided is that the opening remarks by each of the 3 speakers will be 5 or 6 minutes of the kind of broad framing of the problem set. So we'll understand the intersection of different areas of expertise. And then in a second round, we'll dig down a bit and make sure that we're getting to some of the more concrete requirements at both all the way from the individual level to the global level of participation in preparedness. So I'm very happy to turn first to John Balbus, and we welcome your remarks. And I'm going to turn off my video and audio while he's speaking.
Great. Well, thank you so much, Elaine, and many thanks, Leah, to you and to the Institute for Sustainable Earth for hosting this webinar series that we're kicking off. It's a very important topic. I'm going to speak briefly from my perspective as a physician and public health professional, and as someone who has worked for 10 years at the federal level on climate change resilience, and with an emphasis on the intersection with public health and with vulnerable populations, which has been a lot of the focus of my work. And I have four main messages. The first, as we think about this theme of preparedness and social resilience, is that those things, preparedness, resilience, social resilience, are intimately linked to the underlying social determinants of health and health disparities. That we can't really have resilient societies unless we are addressing and recognizing the social determinants of health and underlying causes of injustice and disadvantage in our communities. So any preparedness strategy has to focus on reducing these disparities, reducing disproportionate exposures in communities in the good times, in between disasters, in order to have the kind of resilience that we would like to see in the bad times like now. The second is that in general, preparedness should not be overseen by the people who are responsible for response. These are two separate functions. Most companies would separate the function of risk management, risk reduction, from the function that protects the borders and does continuity of operations. We see too often this neglect, respond, forget, and repeat cycle where we're always gearing up for the latest emergency and not having a focus on the longer term vision. And we see this now in COVID. We've seen it in most of the major responses to hurricanes and other catastrophes, that it's always good to have a group of people who are thinking about the next disaster, even in the middle of this disaster, in order to build back better, in order to do more than just recover to where we were, but in order to make our society more resilient. The third is that just talking about COVID and climate change and what we learned from these simultaneous and yet on very, very different timescale disasters, is that they both reveal a very alarming pattern of the public and sometimes government officials disbelieving scientists who are giving stark, ominous, scary messages. We see this in COVID, that it took 3 months from the time that early warnings were emerging from China until this country took definitive action. In climate change, we've been going at this for 30 years, and I guess I would say we're still not on the path to actually solving that problem. So I think that one of the things we have to do in thinking about preparedness and social resilience is, what are the failings of our education system? What are the failings of our public discourse? What are the failings of societal values and the way we teach, that when we have scientific warnings, they're so often not heeded? And this is not a problem of current times. I usually give a quote from Benjamin Franklin about this problem when he was talking about lead in the 1760s. So never too late to learn as a species. And then the fourth is that I think the health sector has some useful models of the combination of preparedness, resilience, and sustainability. This is an Institute for a Sustainable Earth, and I personally feel very strongly that sustainability is one of the best paths towards resilience, that the more efficient, the less resources that are consumed, the more resilient in a time of resource scarcity. That goes without saying, but too often we build our institutions in a way that doesn't really reflect that. And within HHS, I've been involved in a Sustainable Climate Resilient Healthcare Facilities initiative. We have a guidance document out, and the World Health Organization and Pan American Health Organization, PAHO, have a similar smart hospital initiative that explicitly guides healthcare facilities on how to make themselves both sustainable and and in doing so, building their capacity to withstand extreme events and severe storms. And so I think we need to think about this. This is true for a hospital. It's also true for a neighborhood. That neighborhoods that are not wasting water, that have renewable energy sources, et cetera, goes on, passive cooling, many, many different kinds of interventions that serve both sustainability and resilience. So with that, I'll stop and turn it over to, I think, Greg, and look forward to the questions.
Hi, thanks to Dr. Nichols and the Institute for Sustainable Earth for organizing this webinar series, and glad to be part of the first set of that. Just to put things in context, the COVID-19 pandemic has been the most severe and the widest scope pandemic we've seen since 1918, and it's really created a huge stress test for our public health and medical systems. And unfortunately, it's exposed a lot of structural and systemic weaknesses in our preparedness for pandemics. The only way this is any good news is if we can learn from these weaknesses that have been identified and rectify them in time for the next calamity, which might be another pandemic, or as Dr. Balbus was just discussing, it could be an effect from climate change. The first thing I want to point out is that at the global level, we've been sorely lacking international cooperation. And this goes beyond the individual behavior of certain countries and underlies the fact that, as a general rule, most countries value sovereignty more than they do global health. And as a result, even though the World Health Organization has what's called the International Health Regulations, or IHR, which is the international legal framework that governs response to pandemics and other outbreaks, these international health regulations have been largely ignored during this pandemic as countries have adopted what policies they think serve their own self-interest as opposed to what is in the collective self-interest of all countries that are being affected. And because of this prioritization of sovereignty over global health, the World Health Organization has to rely on the voluntary cooperation of its member states. And it lacks the authority and resources to do really more than that kind of coordination and collate data and provide advice. And while this can be a very important function, just the scope and severity of this pandemic has illustrated how that really is no longer sufficient, given the magnitude of this pandemic. And just one small example is looking at what happened to the supply of personal protective equipment, or PPE, around the world. This PPE relies on a global supply chain for its production and distribution, which means that many countries have some role in producing and distributing these goods that are used by every country to protect healthcare workers and individuals. And we saw a complete breakdown in that global supply chain. And it was kind of the Wild West zero-sum game where every country was out to obtain as much PPE as they could. And this was an area where the WHO really could have played a very important role coordinating national responses and just didn't. And in fact, couldn't because it didn't have the authority to do so from its member states. So at the international level, some severe challenges were revealed that we need to be addressing in the future in order to be more resilient. Just to shift gears to looking at the national level, the U.S. was extremely slow to respond to the dangers posed by COVID-19 and to respond accordingly. And I think much of this can be blamed on the current administration's incompetence and malpractice. But at the same time, there are some deeper causes, some structural causes that would have impeded a response regardless of whoever occupied the White House. And the key thing here is that public health is a public good, whereas we view it more as a private good where it's an individual responsibility to provide for their own health care, as opposed to a collective responsibility and obligation to provide for the health of the entire population. And as a result, we assume that the private sector will supply the equipment and the knowledge necessary to respond to these pandemics, when the reality is that because these hospitals are operating in a competitive marketplace, they need to emphasize efficiency over preparedness and resilience. Because if you're prepared for a pandemic, it means that you're not investing in the most current medical technology that will get you new patients and bring in new sources of revenue. And even though the U.S. government has recognized for a long time this disconnect between the need for preparedness among the medical and health sectors and their kind of lack of incentive for doing so, the United States hasn't had a coherent, long-term, sustainable plan to actually create the right set of incentives and disincentives to get the kind of preparedness we need for our society to be more prepared and more resilient. And we saw this, we saw just how fragile our healthcare system was during the pandemic. Not enough hospital beds, not enough ICU wards with negative pressure, not enough PPE to go around. And again, this is a major problem when our healthcare sector is designed to maximize profits and not public health. I've got more to say, but I'll leave it for there, and I look forward to questions. So I now want to turn things over to Andrew Light.
Thanks very much. A lot of my comments are going to overlap with John and Greg's, and I appreciate the remarks they've given so far. I'm going to focus right on the climate crisis, and I think that probably goes without saying to this audience that this is not a problem that's gone away since we've been living through this immensely terrible time. There is a kind of I think that there's a couple tensions, dynamic tensions that I want to unpack in just a couple of minutes here between recovering from the pandemic and recovering and restarting our economies, as well as attending to the climate crisis. They could be mutually reinforcing. Unfortunately, I think in the United States right now, they're not. It would be great to see a change in that. There's one kind of thing that I want to kind of try to disabuse people at the start is, unfortunately, sometimes people have tried to, I think, kind of fit a square peg in a round hole and sort of say, well, what the COVID is giving us is a sort of a trial run of a kind of of what climate will be in a kind of a more slow motion way. And I think that's wrong. And I think if you talk to people who experienced extreme events like Katrina or the Australian wildfire season just this past year, none of them would say that what their experience then was in slow motion. What we're experiencing is a global sense of what people did experience already and will experience more in the future caused by climate change. And in that respect, we can sort of see how both the COVID-19 pandemic and climate change are these threat multipliers. They exacerbate inequalities, as John's comments started out so nicely and sort of pointing out for us, and they also tell us, as Greg pointed out, how international connection, international cooperation is a necessity and not a luxury. And without it, it is going to be extremely difficult to deal with these common problems like this. Now, in response to this problem, what we're going to see is the mobilization of a huge amount of capital. We're already seeing it. Predictions are this could reach $10 trillion. Just in the last 45 minutes, the House has dropped a new COVID response bill. My very quick addition to it is about $1.3, $1.5 trillion to add into the trillions we've already spent. And this is where we need to make sure that these investments count. And if you look at the kinds of messages that have been coming forward from, everyone from the UN Secretary General to health officials to everyone else, we need to make these investments count. And this is where this phrase, aptly termed phrase, Build Back Better, really comes in, and where the rubber really hits the road on this, because we can choose to inject into the economy in such a way that we can imagine that the problems that we faced before the pandemic didn't exist, or we can try to get the economy restarted, get workers secure, make sure that there's a just transition to parts of the economy that were slowing down already, like fossil fuels, the fossil fuel industry, and inject money into those communities so they can transition to something that's more sustainable in the long run, that will make them resilient both to future pandemics and to the future climate threats, and into the way that those two could interact, as John pointed out. We go back to 2008, 2009, which is the last time in history that we've experienced something like this, though I think the scale clearly of what we're experiencing now is really Great Depression scale. 2008 to 2009, we really did see an awful lot of the stimulus packages going into clean energy. And I'm just going to share my screen to show you just a couple slides on this. Okay, should be up. obviously, to see the total spending of stimulus packages that included a green part of it, going back to the 2008-2009 crisis with China in the lead, followed by the U.S. You look at the U.S. portion of the ERA Act from 2009, it actually is the largest energy bill that the United States has ever passed in one lump sum. And then if we look at the proportions of those, we switch it around to not just total dollars spent to proportions, Korea was actually in the lead with 80% of its stimulus package from 2008-2009 going into something we broadly speaking of as green stimulus, so renewable energy, transportation measures, natural infrastructure, things like this. And there's been a lot of literature that's unpacked that dynamic in the last 10 years. One of the things that we know is that compared to the rest of the OECD, Korea actually rebounded quicker. And there's been, some of this is correlation, some of it is causal, but the literature, the economic literature on the causal nature of this is clear. And if we want, we can unpack that even further in a question and answer period, that just given the nature of those countries that can afford to do it in energy transition, you actually are able to, dollar for dollar, create more jobs when you're investing in new energy as opposed to old energy infrastructure. So far, it does not look like the United States is going down this path at all, and we seem to be an outlier. So we can compare this to what's going on in the EU, Japan, Korea again, even countries, middle-income countries like Chile, we're sort of seeing that more countries are investing in a kind of a green stimulus package, or at least a partial green stimulus package, than the U.S., which at this point is actually still doubling down some in its stimulus packages to date in terms of fossil fuels. Countries will be looking for innovative ways to restart their economies, and that's exactly where they could actually turn the corner on this. In 2009, the G20 made a commitment to phase out fossil fuel subsidies, which was a great accomplishment in the climate world and a great step forward for the G20 into climate action. We have actually not seen very much traction, not very much progress on what that means in the last 10 years, and this would be the opportune moment to do something like that. In closing, though, let me just point to one other thing, and then we'll sort of move on to the question and answer period. And that's the sort of, just because I'm focusing on climate, I want to take care of this at the top. What is the potential climate impact of the pandemic? The International Energy Agency released a great report beginning of last week, which really gives us, I think, the most detailed analysis on this. One is just on the footprint of the sectors of the economy and the sectors of the global economy that have been affected by this. On the top left-hand side of your screen, you can see the share of global population under some kind of containment measure, and it's actually pretty much the entire world. And then if we look at the share of global primary energy demand affected by those same levels of partial and full lockdown, it's over 50%, which is extraordinary, which leads us to this incredible statistic here, which is that we are now going through the biggest drop in CO2 emissions that we've seen since World War II, cumulatively. If you look at all the drops in CO2 emissions since World War II, this is the biggest one that we've ever seen. In fact, it's an average of a 25% decline in energy demand per week by countries who are either in a partial or a full lockdown. And that's extraordinary. Now, the other part of this is that it is only 8%. And then I think there's two lessons from that. And one is that the impacts of COVID-19 demonstrate, as much as they demonstrate the impact they can have on the entire energy economy, they also demonstrate to the degree to which we are still shackled to the energy economy and therefore shackled to the major driver of climate change, which will create an ongoing set of emergencies that we're going to have to continue to respond to, in addition to pandemics and the way that they interact. And secondly, that what we know, if you look at sort of the 2008-2009 financial crisis, the rebound in CO2 emissions actually comes very fast, even with measures where you're trying to stimulate the green parts of the economy. So the need for very resolute and determined action to think about how that dynamic will play out and to double down on reemphasizing and investing in sustainable energy is certainly the order of the day. Thank you.
Okay, so this is Ellen Layson back again. Three really very rich presentations. What I'd like to do to kind of start the discussion as we try to dig down to perhaps some more practical, maybe achievable policy ideas, I'd like to pose a slightly different question to each of our three speakers. For John, you mentioned the important distinction between that governments have to organize themselves so that the people who do preparedness are different than the people who actually are the first responders, if you will, or the people that develop action plans. I wonder if you could help us understand a little bit more the architecture in the American system, and is it that different than other countries? So it's a little bit, you know, CDC versus the science research at NIH versus the, you know, departments of government that implement programs. If you could help us understand the division of labor, do you think it's currently working, even though obviously we have this very volatile media coverage of either it's all perfect or it's all terrible? How would you navigate, you know, is our current system functional if there were enough resources? And is it significantly different than the way other governments organize? I'm thinking of Greg's point about the disproportionate role of the private sector in the American health sector as compared to other countries.
Well, thank you for that question, which actually feels like a lot of questions, and I'll do my best to answer from my limited knowledge base. I can speak for Health and Human Services. We do have a federal emergency management agency. It's relatively recent in its incarnation, and it is a little bit dynamic. And I have to say, I'm not entirely familiar with how it works. But as with a lot of things, it tends to carve out health. And so within HHS, we have, you know, these different functions. We have the CDC, which primarily really functions in a response mode. I mean, the typical public health mode is surveillance, detection. You figure out something's going on, you send your epidemiologists out into the field, they figure out where it's coming from, and then you start the interventions. And, you know, within the field of environmental public health, we often point out whether you're going back to cholera and John Snow or, you know, most epidemics, by the time we figure out that they've started and what they're coming from and start and mobilize the interventions, often the epidemic under its own weight is starting to go down. And so there really is a need for early warning and not just waiting for the first cases. So that's kind of point one. Even within the CDC, there is not a well-developed function that is doing horizon scanning, that is looking at, you know, genetic drift in ecological systems where things could cross species. We don't really have that function all that strong in any part of the government. But then the other piece of this is, you know, HHS has been reconfigured a few times. I'm not a historian of this, but right now we have an office that's the Assistant Secretary for Preparedness and Response. So preparedness and response are the same agency, you know, the same division within HHS. And, you know, it's challenging because if you think about the last 10 years, whether it was the Gulf oil spill, whether it was the hurricanes of 2017 that came one after another, Maria, you know, Hurricane Harvey in Houston, then it was the opioid crisis. We had a crisis on our border with health. There's always a crisis. Mm-hmm. And what has happened is that, you know, who might have been there for preparedness, they get pulled into the response. So there really needs to be a very, you know, at times there has, I think, been a piece that has been tasked with that forward-looking and that preparedness, but it just has never been developed very well and very separately. And so, you know, my personal, non-official thought is that it would be good to have, you know, an office of risk mitigation and risk reduction along the lines of the Sendai framework, that whose sole focus it wasn't on detecting the threat right when it happened, but the forward scanning and what do we need to do to have, you know, the generic things in place to be able to respond.
Yeah. Well, just from the kind of national security perspective, it's certainly true that people think that the Pentagon is almost the only part of our system that knows how to truly prepare. That on the civilian side, the preparedness folks are kind of nice to have, but not working on the current issues. And so when a current crisis, you know, erupts, suddenly the planning folks are deployed to do, you know, more day-to-day response and stop looking at the horizon. So thank you for that.
And that's one of the issues with climate change is if you look at the billion-dollar disaster curve, they're coming fast and furious. And so, that's one of the places where climate change comes in, is that the pace of natural weather-related disasters has picked up, and it makes it hard to have people continue to focus on the preparedness.
Greg, for you, I wonder if you could say a little bit more about the world of, biodefense and bioweapons. Is the network globally of folks who cooperate on bioweapons issues or biological threats, are those folks mobilized successfully, effectively, in your view, to also contribute to the civilian health response, or are they kind of in their own separate world? What kind of crosswalks do you see between the work that is done in the security world when the knowledge they may have could be pertinent to a public health crisis?
I think we've seen a pretty good coordination, integration of the kind of the public health world and the more specialized biodefense community. And because I think in part because within the biodefense field, one of the kind of the key principles is that the best defense against a biological attack is a strong public health system. So there's been a lot of effort to try and make sure that what we do for public health emergency preparedness would be effective responding both a natural outbreak or a pandemic or a deliberate attack. So there's a lot of synergy that we've kind of built into the system, which is good. There are a couple of kind of examples of this in practice. There is a facility up at Fort Detrick run by Department of Homeland Security called the National Biodefense Analysis and Characterization Center, and they've been doing a lot of the research on how stable and survivable the SARS-CoV-2 virus is in the environment and on different surfaces, and testing different decontaminants and disinfectants to see which are most effective at killing the virus. And this is work that they have to do under a pretty high level of biosafety, but they're able to do so because they have a facility that was built for biodefense purposes that they're now using to help respond to this pandemic. So there is definitely this kind of dual use benefit that comes out of having a strong biodefense enterprise that is able to work on these kinds of issues when they arise.
But I've assumed that we only share knowledge or cooperate on the biodefense side with friendly countries. So it's not quite global in its scope. Is that right? I mean, do the Russians and the Chinese cooperate with other countries and we cooperate with the people we trust? Is there a little bit of a political overlay to that level of cooperation, or does it function, more or less internationally?
I mean, for the more specialized kind of biodefense projects, like developing vaccines against things like anthrax or smallpox or plague, those tend to be very closely held and really only done among allies. But in the broader space of even, for example, biosafety level 4 laboratories, which do both kind of public health work and some biodefense related work, those labs cooperate and share information and knowledge across borders. And so U.S. biosafety level 4 labs here we're actually working with and collaborating with the Wuhan Institute of Virology, which is China's first BSL-4 lab. They sent some of their people here to a lab in Texas for training. Some scientists from the U.S. went there to work at the Institute for a time as well. There's joint research projects that go on. So a lot of these things, again, because they deal with public health concerns and emerging infectious diseases, they're able to be done in a more cooperative way that doesn't get into issues about security and classification and classified information. So that there's still a good amount that can be done among different researchers and institutes that don't stray into areas of national security.
Mm-hmm. Thank you. You mentioned the international health regs, which, as we know, were promulgated in 2005. I've heard it said that as a result of the IHR, in fact, the authority of the Secretary General of the World Health Organization was effectively diminished, not strengthened, because the IHR, having a sort of treaty quality to it, invests all the implementation at the sovereign state level. It doesn't really create new, supra-sovereign cooperation. So is that an argument that rings true to you, that one of the criticisms of WHO these days is that, the Secretary General either has his own biases towards China, or that in fact his authorities are actually quite constrained? and his ability to sort of try to really implement a strategy that's been agreed to by member states is quite limited. Would you comment on that?
Well, the WHO's authority is limited because that's what the member states voted on when they voted on the international health regulations and negotiated those that international law. And so again, it's an example of sovereignty trumping global health, that countries were not willing to give up some of their authority for managing major public health crises to an international organization. And so they relegated the WHO's role to basically collecting information, collating it, advising, but not giving them the authority or resources they would need to actually respond in a really strong, meaningful way in the event of a pandemic. And so this is kind of weakness by design. And so it's not really fair to blame the WHO for this, because it's the member states who all agree that this is the way they should be operating. And I think, again, given within their constraints of their authority and their resources and what they could do, I mean, they've done some really important things in terms of organizing a global effort for vaccine research and R&D, right, providing information and knowledge to less developed countries that don't have their own agencies and research institutions that can provide the kind of recommendations about how to operate safely in a hospital, or how to do the kind of the diagnostic work that needs to be done for testing. But the real kind of shame and tragedy that I think this pandemic exposes is that the WHO could have done a lot more. We would have been in a much better shape if there had been stronger international cooperation, if there had been a better, stronger framework for implementing some of the advice that's coming out of Geneva. And I think this is going to be one of the real after action items that needs to be looked at is what needs to be done to revise international health regulations in order to strengthen international cooperation moving forward. I think that's going to be a major topic that we're going to need to be discussing for a while.
Yeah, good point. Thank you. Before I pose a question to Andrew, I just want to encourage our audience to start putting some questions in the chat box so that we can bring you into the conversation. What I do, I have a question for Andrew, and then I'm going to invite the three speakers to ask each other questions or agree or disagree with each other as they choose, and then we'll open it up to the audience, and I hope some of you will have questions. So Andrew, I wanted to draw on your experience being part of the negotiation of the Paris Accords. You had a geographic focus, but I know you saw the big picture of what the sort of grand strategy was and the level of international cooperation. How much did you feel that countries made the connection between health conditions and climate change? Was that implicit, explicit? Were there any crosswalks between the Paris negotiation process and other instruments of global cooperation? So would the WHO have, experts participating at any level of the Paris process? And just tell us whether the Paris Accords are still relevant. Are they still germane in this, very dynamic environment?
Yeah, so I definitely think that they're the most relevant. I mean, one interesting thing is that in the way that the Paris Agreement was created, some of you will know that it wasn't just people come up and they make one pledge out to the future to try to achieve, our big temperature stabilization targets of limiting temperature increase to 2 degrees Celsius over what it was in the pre-industrial period, and every effort to lower it to 1.5. So this whole order, we've already warmed the planet 1 degree, and we're seeing ample climate impacts already. But it was set up on a cyclical process. So parties made their initial pledges in 2015, either to 2025 or 2030, and this year, 2020 was going to be the big year because it was the first time that parties were being asked to come forward and enhance their targets under the agreement. So this is probably the biggest year in the climate negotiations since 2015. We saw some mixed progress towards that, and I think that, some of it, I think, is probably that a lot of countries were waiting to see what's going to frankly happen with the U.S. election before they decided to what they were going to do in terms of putting down their new pledge. The next big meeting of the parties to the Paris Agreement was going to start 3 or 4 days after the November election, which was also around the time the United States was going to be officially finally out of the Paris Agreement. And so the schedule was pretty tightly compressed. The British government, the next meeting was set to be in Glasgow in November. British government's postponed it, and so we don't know when it's going to land. It looks like either June or December of 2021. I think that what that's going to mean is that we're going to get a helpful, ironically, and I wouldn't have wished this, but because of this terrible ordeal we're going through, countries are going to be able to see what happens with U.S. election probably before they do put down their next target under the Paris Agreement, and that's actually going to potentially create, especially if we have a new administration that wants to get re-engaged on Paris, there will be some time to engage those governments to show what the U.S. is doing. In terms of the overall dynamic in Paris and the health, the role health played in there, I'll say this, that I really think that, not health in particular, but the two things that really made the creation of the Paris Agreement different from the agreements that came before it, the Kyoto Protocol and the Copenhagen Accords, is that the science had just gotten more important. So one thing was just clearly that global leaders were more worried about multiple kinds of climate impacts, including health impacts. And that brought them to the table in a much more serious way. They were concerned about extreme weather, sea level rise, everything else, and that the accumulation of the science had been demonstrating that our climate models had really been pretty conservative in predicting some of these things. The second thing, we can talk about this later, but sort of briefly mention, was the economic picture was getting so much better on clean energy, in part because of some of the lessons we saw how green stimulus did create jobs at very low cost from the 2008-2009 stimulus, which created this impetus for a kind of an experiment to demonstrate this. But I think that what really happened is that after Paris, there were two very important reports that came out, one U.S. and one international. One was the Intergovernmental Panel on Climate Change issued a report on the difference between a world where you stabilize at 2 degrees Celsius versus one where you stabilize at 1.5. And one of the things that they demonstrated was how much worse many of the impacts, including health impacts, would be at a warmer world. Almost immediately thereafter, you get a report from the United States, the U.S. National Climate Assessment, which both John and I worked on. John led the chapter on health for that report, which again sort of broke down the United States into 10 regions and demonstrated how climate change would exacerbate health impacts in those regions. So I think this is very much on the minds of everyone in the climate community now in even a much more palpable way than it was before this pandemic evolved.
Mm-hmm. Thank you, Andrew. So I'm going to just open the floor to our three speakers. If you any points that any of you made that you'd like to comment on or expand a bit on. So the floor is open among the speakers. We still haven't seen any questions from the audience.
I'd love to just piggyback on what Andrew said about health and its role in the UNFCCC discussions and agree with him completely. And just point out that I think that there is a tremendous potential for the health sector to be playing a much more important role and to actually, what has happened between Kyoto and Paris is that every year there are the number of health people in the city has gone up thousands of percentage. So there's a big congregation of health people now every year. The WHO coordinates it. We have a big summit. But the number of health people that are actually entering into the room is about the same, close to zero. And, there's been a lot of talk about the health impacts. And Andrew, as Andrew said, the science of the health impacts has gotten on people's minds much more. Something that has not, I don't think, gotten the airplay that it could is the flip side of health, which is that if we now lose around 7 million people a year from the combustion of fossil fuels and biomass, both in the outdoor and indoor environments. And, if we were to move to a completely green energy source world, there would be millions of lives saved. And there are many, many studies documenting this, and an increasing number of studies that actually place an economic valuation on the lives saved and the health benefits of mitigation and reduction of greenhouse gas emissions, especially from burning things. And the economic valuation in almost every analysis surpasses the cost of achieving 2 or a 1.5 degree target. And I think that's a point that really has not pervaded the discussions as it might.
Yeah, if I can just add on to that and continue to agree, but I think that, look, I mean, go back to the ample studies that have now been done on SARS. You know, we know that you were more likely to die from SARS if you were in a country with if you already had in a country with ambient air quality problems, where most of your energy mix was coming from fossil fuels. I mean, these things are strongly identified and strongly traced and strongly correlated. You know, the good side of this, I think that the argument for the health co-benefits of climate action was getting a lot of traction prior to this point in 2014, 2015, when countries were setting their initial targets under the Paris Agreement. And in fact, in some countries, like I had special responsibility for India when I was in the State Department, and there we actually flipped it around because there was pushback on climate response, but the air quality problems were so bad, we said, okay, let's work on air quality, and then climate change will be the co-benefit. And I think that, you know, and given the dramatic pictures we're seeing now, or we saw a few weeks ago coming out of Delhi, of what Delhi looks like, you know, when things slow down on the fossil front, there is some hope. I mean, this will be extremely difficult to see that conversation get a resurgence just because people will have experienced something different on that. The weakness is on the international agreement side. So in those individual country pledges, you saw people actually make references to health and certainly to black carbon and those kinds of issues. What you don't have in the Paris Agreement is something that is a really strong pull for cooperation on the health side of climate in the same way we do, say, in the forest sector or something like that. And I think that would be hopefully something in this next year, while we've got kind of a pause in the international climate negotiations, people will be looking for ways in which we can integrate that conversation together, not only there, but also the Convention on Biological Diversity and other places like that.
Yeah, another aspect where the health and the climate change intersect is around this issue of, you know, the zoonotic origins of diseases.
Yes.
Right, this pandemic was the result of a virus jumping from an animal reservoir into a human population. And we don't understand, you know, the exact conditions under which it happened, but we know, generally speaking, when you have animals losing habitats due to environmental degradation, you have humans encroaching on their normal habitats or hunting them, and you know, and generally increasing the interaction between humans and these animal reservoirs, right, increases the number of opportunities that these viruses have to jump from their animal host into a human host, and if the conditions are just right, starting a pandemic like we're seeing. And we've seen several examples of the way that the climate change and warming affects the range of vector-borne diseases, right? The fact that mosquitoes can live at higher altitudes in some locations, they can range farther, the latitude and longitude-wise, right? They're able to spread disease more effectively. Right? This kind of crossover event from animal to human, the spillover event, is only going to become more common as the environment gets more devastated, and we try and adapt to that and inadvertently create new opportunities for these viruses to emerge into human population. So I think that part of the conversation will also get hopefully a lot more attention given the nature of this outbreak. And again, it's the same thing we saw with SARS in 2003, which is another animal crossover event. MERS in Saudi Arabia and the Middle East is another animal crossover. And that's the reality, is that most of the diseases that are the biggest threats to human health actually come out of animals and out of wildlife. And climate change is just putting a huge stress on that. It's really going to get worse. So hopefully that nexus will help also propel discussions on climate change, understanding the myriad health impacts that phenomenon has on us.
Okay, so let me ask a kind of amateur question. I've always kind of sensed that one of the secondary effects of climate is going to be large population movements to cooler climates, that, you know, the hottest part of the world will become less habitable. We see water scarcity, temperatures of 120 and 30 in, you know, the Middle East and South Asia, so that will populations start to move. And yet a cross-cutting issue is that this virus apparently doesn't like heat and humidity. So are we seeing that, first of all, this particular coronavirus is affecting, you know, is it less of a serious threat in warm tropical climates? Is it most of us in the temperate zone who are suffering more from it? So it's kind of two different questions, but one is, are there kind of large demographic implications of climate change, and is this health crisis a sort of particular part of that story? Are we seeing climate differentials in which countries are having the worst time with this virus?
So let me offer some thoughts on that. I think that the question of seasonality of the COVID virus is still far from determined. The National Academies has released a report summarizing some of these preprints. There were very few peer-reviewed studies. There are a number of unpeer-reviewed studies that show some correlation between latitude and bands of temperature and absolute humidity, suggesting that there are some similarities with the influenza virus, which is more easily transmitted, does survive longer at relatively cool temperatures and low humidities. But at the same time, we clearly have outbreaks and epidemics and scores and hundreds of deaths in tropical countries like Singapore and southern China, Vietnam, et cetera. So there's no, certainly no completely protective factor from a warmer temperature. I think that lack of habitability is lack of habitability. And if you are living, in the Sundarbans of Bangladesh and India or other really low-lying areas and, low-lying island states, if you're living in the Gulf region where, temperatures are getting in, as you said, to the 130s, 140s, this is a persistent factor that's not going to go away, only going to get worse. And so I don't think that, a pandemic like this that may have some relative predilection for slightly cooler temperatures is going to alter the hard reality of population movement where, not only do you have those physical problems of water supply, saline intrusion, loss of coastline, but you also have a lot of health problems there too that are climate sensitive. Dengue, all the vector-borne diseases, the mosquito-borne diseases, the waterborne diseases are worse in some of those places than in the cooler climate. So if you were to balance off all the health stuff, it doesn't keep people from leaving them. Yeah.
I have 3 questions from our audience. So what I'd like to do is give you the 3 questions, and then we'll go through. Each of you can comment on whichever question interests you the most, or more than one if you like. So one question is, how does one, going back to John's original presentation, how does one kind of change the calculus of political will and political kind of benefit to spend more money on preparedness, to take preparedness more seriously? Is that something that this crisis will perhaps, be a turning point? Can we create that political will? Another question is whether there's kind of some long-term climate benefit of people learning to stay at home more, adopting, less face-to-face. People think from a labor perspective, probably one of the effects will be that more people work remotely. Do you see any significant climate advantages to this shift in socially how we work and how we interact? And then the third question is, any practical, specific suggestions for what people in the DC area can be doing, should be doing for preparedness and resilience at, the community and metropolitan levels? So kind of very practical, are there things that we can be doing and make Washington an example, if you will? Those are the 3 questions. I'm going to let maybe Andrew go first, and then Greg, and then John.
Sure. On the last question, or well, let's see. I think it's actually the middle question, which was the how will we see an impact from the changes in the behavioral changes we're all going through right now? And I think there is some hope there, and I think that we're seeing lots written about this now, about, for example, whether virtual meetings and less travel will have a reverberating effect. And I think that there is partly, we're going to see I think that some workplaces are going to start rethinking this as they see the changes to their budgets, at the end of this year and what went up and what went down, and how that could potentially lead to longer-term savings. I think that there will also be a long delay of people just getting comfortable in traveling if they don't think it's absolutely necessary, no matter what happens in terms of, which part of the scale of the threat level your particular country goes to. And I think that the airlines are, unfortunately, having to prepare for this. It will be years, I believe, until we get back to levels of air travel that we saw, let's say, last August or last summer. Whether or not we could nudge people in that direction, I think will be the sort of the public works project for behavioral economists for the next year, right? How to sort of nudge people in those directions to hold on to some of this. To kind of take those other two questions on political will, I just want to make kind of one observation on this. The world, a lot of the world is moving forward in a green stimulus model, or at least a partially green stimulus model, in the way that we have good evidence that, worked in 2008, 2009 in some parts of the world. I'm not going to switch over, but you just look at 2008, 2009 is when China took over the solar market for solar cells. I mean, there's a lot of markers where that major injection, of money led to lots of good outcomes. We are not having that conversation in the United States right now, let's face it, mostly for ideological reasons, and mostly because I think the people who even are champions of those things are really hesitant to bring them out and be tarred with not caring about the growth of the economy. And this is going to be sensitive, and we're going to be riding through this for a number of months. The other side of it is that cities like D.C. and the District of Columbia and states like Virginia and others are really the climate leaders in the United States. They have been since 2016. The big difference between those climate leaders at the state and city and business level and the federal government is that the states can't print money, right? They can't do that. They can't stimulate themselves in that way. I'm going to be looking really carefully at whether or not this next tranche of stimulus spending that's coming out of the House, where about $1 trillion of it will go to non-federal leaders, non-federal actors and entities, is this only for closing budget gaps? Or will this enable some of those climate leaders in those levels to move forward? And if they do, then that will be the opportunity for citizens like us to try to influence that conversation.
In terms of resilience, I think one of the really kind of one of the few silver linings is how resilient local communities have turned out to be. Right, we've seen neighborhood groups form to take care of elderly citizens and people who can't go shopping for themselves. We've seen people turn into do-it-yourself mask makers. We've seen how well that school systems have adapted to remote teaching and being able to provide meal services to students who rely on them for their nutrition. So even though we've had this incredibly disruptive event, I think there are a lot of kind of good news stories at the local level about how resilient communities were in the face of this. And I think that's something that can be capitalized on, because at the end of the day, if resilience is done right, it should cover kind of all hazards. It shouldn't matter if you're being resilient against a pandemic or a hurricane or tornado or zombie apocalypse, right? If your community is prepared for an unexpected disaster, right, there's just a certain number of things that you're able to do if you don't have power or if people are unable to move around normally. And so just that kind of planning, regardless of the specific scenario, I think is a huge benefit to go through and prepare communities for anything that might come. And, that also can help build awareness, that can help build buy-in from, citizens that they need to be prepared for these threats. And at the end of the day, also, the other big takeaway is an ounce of prevention is worth a pound of cure, right? The fact that, our public, investing in public health and surveillance for new diseases is incredibly cheap compared to the cost of responding to a pandemic that catches you unprepared. So that is true for global health. That's true for climate change. So seeing the enormous costs involved with responding to this kind of event, I think will also help change the calculus about, let's treat surveillance, or let's treat, investing in green energy sources as an insurance policy. And let's invest a little bit at a time, and that will pay off in the long term. So I think hopefully this this very disruptive catastrophic event can help change some mindsets about the kinds of risks we face and the kind of common sense things we can do to prepare for the whole range of threats that we face, locally and globally.
Thank you.
I'm going to close on a slightly different note and very briefly. I agree with everything that's said, but I will say that a change in political will is unlikely to hinge on a good analysis, a good graph, or a good set of figures. A change in political will is going to hinge on a change in emotions. It's going to change in societal values and what we think is important. And I think that one of the things that we're seeing along the lines of what Greg and Andrew are saying is that people are rethinking what's important right now in a very profound way. And the question is whether they will hold on to it. I think people are recognizing, when we've talked about climate change, people who would rather not do anything about climate change have already talked about the huge sacrifices it would mean. The word sacrifice was said again and again and again as if it was a bad thing. And I think that we're seeing now that people are finding that sacrifice can be empowering, that sacrifice maybe isn't a bad thing when there's a bigger threat that we have to all pull together against. And there's a whole emotional side, a whole value side. We're seeing this in our popular culture. And I think if something good is going to come out of this terrible ordeal we're going through, it will be a change in the emotional pulse of the people of this country and really the global population.
Well, John, that's a really powerful and uplifting point on which to end, that we're all witnessing some small shifts in whether they can turn into something sustainable. So let me end on that word sustainable and ask the Institute of Sustainable Earth whether, Leah, would you like to make any closing remarks? But I just want to thank the panelists for terrific discussion.
Thank you.
No, thank you all for such a fantastic discussion and your participation today. I do want to ask all of the people in the audience to join us next week. Our second seminar in the series is going to be focused on ecological health, public health, and security, a theme that did actually emerge in this conversation. We'll drill down deeper into the connections between ecosystems and public health. That will be occurring Monday, May 18th at 11 a.m. So hopefully we'll see you there. Thank you all very much.
Thank you.
All right, I will save the recording and I will pass it out to you, Leah.
Thank you.
Thank you.